is absolutely correct and right in quoting Singapore and the remarkable results that they get from their health system. As he said, their current expenditure is in the order of 3.5% of GDP, compared with ours at 8%, Australia's at 9%, and the USA's at 15.5%, and yet they live longer, and the infant mortality is actually less than half of ours. And it is underpinned by a variety of very clear principles that were worked out in a white paper in the 1990s. But I must add to that, I do not believe the New Zealand ethos would quite accept the autocratic way that Singapore works. But, Mr. Speaker, we certainly do have lessons, and we can learn enormously from the remarkable outcomes that they have achieved. Yesterday, Prime Minister John Key was clear and concise in his statement. National will focus on building a strong economy vital for an excellent health, welfare and education system, and National will focus on building better results from our public services. And goodness me, they do indeed. We have that record of Labor where it spent over 9 years double the amount of money for absolutely no increase in productivity. And John Key's speech was in sharp contrast to that of Phil Goff, who presented a somewhat vein-popping, shaking hand charade of where he proposed everything that was the reverse of what he said he believed in back in the 1980s, where he failed to acknowledge the last Labor government had built up the public service by 50% over 9 years into a creaking bureaucracy with very poor productivity, and as I said before, particularly in the health sector. And where, contrary to the advice of the Working Savings Group, he wishes to spend, and so far that's been tallied up to over $5 billion, and there's still much of the year left, and he has not explained how he is going to get the money to pay for his promises. And all this in an environment where the Working Savings Group says New Zealand's level of debt is too high. Net foreign liabilities, public and private, amount to 85%, leaving New Zealand vulnerable to economic shocks, and according to them, absolutely vital that we increase savings as an essential component to reduce the vulnerability. National is taking a prudential and measured approach to the economy in stark contrast to Labor's somewhat reckless and irresponsible spend and bribe the vulnerable, just as they did back in the 80s and repeated it over the last 9 years. But, Mr. Speaker, I was astounded but not surprised this afternoon to listen to that veteran shroud waver, the Honourable Annette King. She was complaining that the Prime Minister should have talked about growing the economy. Well, I say to the Honourable Annette King, she was given a copy of his statement. She could have read it, but she continues to be in denial over the last few decades. I'm very happy to present her with another copy. But why did I call her a shroud waver? Because in 1998, when she was opposition health spokesperson, she said that it was criminal that the present Minister of Health had allowed waiting lists to expand out to 86,000. And yet, 2 years later, She had presided over building one of the most complex, cumbersome, lowly productive health systems in the history of New Zealand. In the history of New Zealand, waiting lists had blown out to 140,000, and she was culling the waiting list in lots of 10,000 at a time. And in very sharp contrast to that, Mr. Speaker, over the last 2 years, Health Minister Tony Rowell has achieved some very remarkable results shown up in the health targets. Shorter stays in emergency departments, improved access to elective surgery, something like 400 extra elective surgeries per week, shorter waits for cancer treatment. 99% of people referred for radiation cancer started treatment within 6 weeks. And Mr. Speaker, I can vividly recall under Labor literally plane loads of patients going across to Australia for radiation therapy. Increased immunisation. 87% of 2-year-olds are now fully immunised. And there in the Lakes DHB, an increase in immunisation of 22% in just the last year. Better help for smokers to quit and better diabetes and cardiovascular system. These are actually objective advances that have occurred in the last 2 years which are quite remarkable. It is a good thing that at least Labor voted with the government on the recent Health and Disability Amendment Bill, which allows for greater national and regional coordination of our health system and the introduction of the very important Health Quality and Safety Commission. Mr. Speaker, I was also very glad that the Honourable Annette King, in a speech in October 2010, to quote, said she had been thinking and re-examining all of Labor's policies. I believe it will be very good for New Zealand, Mr. Speaker, if she stays in opposition and continues to think for a very, very long time. I was also glad that she has decided to work on a policy she calls putting children first. There's no doubt in my mind that over the last few decades or even longer, New Zealand's record at putting children first has failed miserably. Successive governments, and it's hugely important for our country that this situation is reversed. I sincerely ask Mrs. King to look carefully at the excellent policies the government is evolving. They have to be cross-sectoral, they need to be evidence-based, as is so strongly advocated by Sir Peter Gluckman and people such as Professor David Ferguson, and they need to be from preconception on. I note that Annette King talks about from 0 to 2, but she must think prior to that, and I'm sure Stevie Chadwick, the Honourable Stevie Chadwick, would agree with me, because after all, the toll on fetuses in New Zealand from alcohol, from drugs and tobacco is hugely profound and substantial. National is very shortly going to bring through yet more legislation to progress reducing tobacco and alcohol along with our coalition Māori parties in this country. And that's got to make a huge difference. And I'm very sad to see Stevie Chadwick not taking this issue extremely, extremely seriously. But Annette King must be realistic, because I note at the beginning of her October speech she said detailed announcements, including costings, will be made in due course. Once again, we see from the Honourable Annette King a situation where she talks, her rhetoric is extraordinarily valuable, but we have not seen a record, in stark contrast to a national government which has a proud record of evidence-based improvement in the health system.